This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio. Love to take your phone calls. I'm waiting for you, 888-630-9625. That's 888-630-9625. What a gorgeous, gorgeous beginning of a tease of a spring day outside. It's beautiful. About 48 to 50 degrees, 51 where some of you are, and it's just absolutely one of those days where you want to go for a walk. There's not a lot of wind out there. It's perfect day. So enjoy it. Get that SAD, that seasonal affective disorders to start kind of floating away and making yourself happier and willing to engage and do more things for yourself. It's gorgeous. Absolutely stunning. Love to talk to you today. Let's talk about your problems, but I want to also get back into the topic that we've been playing with for several weeks on brain injury and an understanding brain dysfunction and brain injury patterns and how they manifest in certain symptoms. And, as we said over a period of time, that it doesn't take a lot of trauma to the brain or the upper portion of the neck to cause significant impairment in how you do what you do on a day-to-day basis. It's really quite alarming in many situations. So, for example, you go over a period of time, you see a child, and we can't put them in a cocoon, but they get banged and they get hit and they fall, and we do the same thing. We fall and we get hit and we get traumatized, and we're out doing the things that we love to do, from skiing to court games, and sometimes we just slip and falls and we bump our heads on cabinetry or on the trunk door or whatever. And then over a period of time, these small injuries compound one on top of the other, ultimately presenting in a symptomological representation of many different things. Everything from anxiety, depression. You can have stress. We talked about post-traumatic stress disorders, PTSD, and the effect that has. You can have the inability to focus, the inability to concentrate. Suddenly you were a whiz kid and you were able to study with the greatest of ease, and all you had to do is look at material and you were able to process it. And now suddenly you realize that it takes a whole lot more for you to be able to learn the same type of material, and it's not okay anymore. It's a struggle. So you start shutting down. You don't reach as much as you used to reach. It's not a pleasure just to sit and learn and glean information. And where does it all come from? I mean, from tremors and neurological dysfunction of all kinds. We can even see high blood pressure. We can see breathing problems. A lot of people with COPD, pulmonary obstructive disease, start with injury to the upper portion of the neck, into the brain stem area of the body, into the limbic area. And it shuts down the capacity to breathe easily. Why? Because that's where the automatic operation of your body starts. And so things like breathing and heart rate, a lot of those things come from that area. So suddenly you don't know why, but all these things begin to show up because there is a cranial irritation. The bones, the 22 bones of your skull that move as you breathe in and out and move the spinal fluid around and down and up, and the nerves that come out, both the cranial nerves, the 12 of them, and the upper spinal nerves. You have 8 in your neck, and they go to organ systems, not just to muscles. And it's like taking a rheostat and a dimmer switch and shutting it down. It doesn't work the way it's supposed to work. So you go to the doc and you go to traditional medicine and they hook you up and, they say, well, you have a little bit of the optimum levels of your delta waves or your theta waves or your alpha waves. They're not working the way they're supposed to. They're not in the proper frequencies, but they don't know really why. They just have to try to figure out how to fix the end product. So over time, these patterns begin to manifest themselves in symptoms. When the brain is functioning normally, your immune system works well. But when the upper part of your neck and the brain is not working the way it's supposed to or meant to be, your body responds by debilitation. You can't fight things off the way you're supposed to. Your body's automatic sensors, your protective mechanisms, don't kick in the way they're supposed to. So it's important to understand that it's not just something that happens to you. Sometimes life accumulates over a long period of time. Sometimes life happens, but you don't realize that it's happening because you're never taught to look out for, the little subtleties that take place. What you end up with are these bizarre symptoms that, why me? And they begin to stack over time, but we don't do anything about them. We learn that there's certain mechanisms within the body that have certain end products. But unfortunately, we focus on the debilitation of the end product and not the why behind that. In my practice, over 38 years of seeing patients with all kinds of symptomological representations, the key to what we do is always asking the question, why something has taken place, why it's there in the first place. What triggered it? What caused it? And when you understand the nervous system, when you understand how the electrical system of the body is rigged, if you will, you begin to get an understanding of why the body breaks down. The brain controls everything that you do, from involuntary functions, as we've been talking about, breathing patterns and fight-flight reactions. You go and you get near something that's hot, you touch it, you withdraw very quickly, and it handles even temperature regulation. Your body has to stay at a certain even level of temperature control. When it doesn't do that, then you begin to break down. Your personality, your ability, as we said earlier, to learn, all of those things have to do with the brain. But there's so much more. It's essential to understand that any kind of injury to the brain, no matter how slight or how significant, does not just affect the immediate symptomological, my head hurts, or I have swelling, or my vision is off, or I'm not doing, but it affects far-reaching paradigms across the board, and that's where we get lost sometimes. We really don't understand the downstream of what takes place. We see people kind of doze off and then stare off and say, hey, are you okay? What? And they come back to you for a second. A lot of times that lack of focus is just not daydreaming. It's the brain's kind of short-circuiting, the inability to handle moods. All of a sudden you have a trigger and you flare and you say, that's not like me. I've never done that before. Why is that happening now? In severe cases, obviously, we could go into restrictive cognitive function, almost like a coma, but not quite. And we're just out of it. We're not in that place. And you can go into a place called Brain Injury Association of America and check some of the interesting symptomological presentations for subtle brain patterns. But in many instances, if you catch these things early on because of traumatic impact to the spine, because of traumatic impact to the cranium, you can begin to turn these things around. People who can't sleep, people who have headaches all the time, no matter what they do, they've seen good practitioners. They've seen great chiropractors and osteopaths and acupuncturists, people who get amazing results with everybody else. But in your case, in this particular situation, it's not working the way it's supposed to, because the why is that becomes deeper and it's not as profound and not as obvious as it should be. So you have to take a look deeply. You have to go and find out where these mechanisms have been altered, but more importantly, what caused them to be altered really in the first place. Over the years, I've had the great opportunity of examining all types of different conditions, and I've learned from each case that's walked in. I've seen patients who truly are structural damaged patients. They've had cumulative injury over a period of many years, starting when they're a child. They've fallen, they've hit their head, and in our society, particularly if you're a boy, you tell them, suck it up, just get yourself up and keep going. You're fine. Don't worry about it. Boys don't cry. And, even when it's a young girl, we have more empathy. We have more compassion sometimes, particularly in my generation. But we kind of ignore that. after everything's better and the tears are gone and so forth, we just kind of move on downstream and see what happens. Well, unfortunately, see what happens shows up many years later in all types of symptomological damage. The symptoms of injury are significant depending on when they're found, how long they go on. From a car accident, something as simple as having somebody hit you from behind or from the front or T-bone you from the side. Symptoms of brainstem, particularly injury, in a hyperextension, hyperflexion, that's called a whiplash. Your neck is going back and then forward. The symptoms vary depending on the intensity of the injury. And it can span, as we talked about, from very significant cognitive irritation to, unfortunately, in very, very few cases, fortunately, into coma. But you have to look at what's happening. You have to identify it very early on in the onset. Otherwise, you have a problem. So damage to the structural system affecting the nervous system of the brain, the lower portion of the brain called the brainstem, up where the top vertebrae start, is one of those things that we don't look at, and we don't look at the why behind it. So examination, neurological examination, but neurological examination from a functional point of view. A lot of you are patients of mine. And when you come in the office the first time, one of the things I'm going to do is I'm going to do a functional neurological assessment on you. Little things. Like I'm going to have you stand on one foot. I'm going to have you stand on the other foot. I'm going to have you try to stand on one foot with your eyes closed. I'm going to have you try to stand there just with your eyes closed. I'm going to have you rapidly move your fingers like you're playing a piano. Or I'm going to have you tap your kneecaps, as fast as you possibly can go. And I'm looking for disassociative patterns that begin to tell me that your nervous system is not working the way it was meant to be or should be working at that time. So it's very important that when we evaluate neurological dysfunction, that we take it from the brain down. We take a look at the brain, we take a look at the brain stem, we take a look at the spinal cord and the effects. So brain stem damage, and I want to talk about that, can be significant and immediate, or it can be very gentle and it can be limited over a period of time. So what do I mean by that? Well, people find sometimes that they start not having the balance that they should, or they don't have the sensory motion that they, or feedback that they should. We start seeing heart problems. Why heart? Well, I only hurt my neck or my head. Well, you have to remember the heart has 3 neurological pieces to it. It has the pacemaker within the heart. It has the vagus nerve, which is a brain nerve. It has nerves coming from the spine, which we call parasympathetic nerves or splanchnic nerves. And all of these guys make the heart work in orchestration. But when you have that injury to the automatic centers of the brain or the spinal system, pretty soon the heart begins to shift. We begin to see breathing problems in an exaggerated attempt to bring more oxygen into the body. We begin to see the heart begin to skip beats or flutter or beat around in a rapid manner and then all of a sudden regain its normal memory. That's a tachycardia type of thing. And many of you have been put on Toprol because of that, when it can be fixed in other ways. We talked about balance. And the gait, you have a staggering type of gait. You can't keep things moving the way they used to move. Symptoms of brainstem irritation due to injury that we've talked about has to do with many different representations, including loss of sensation, even the inability of your organ systems of digestion to work properly. Suddenly you got hit in the head, or your stomach's and your stomach's not working the way it's supposed to. Suddenly you hurt your neck and you can't digest food, or you become constipated. And nobody hooks those things up. But that nervous system is the paramount motivator and moving mechanism in your body, and it has to be looked at. And that's what we're going to talk about a little bit today, but I want to talk about your situation, so give me a call, 888-630-9625, 888-630-9625. Let's handle your things, because that's what this program's all about. It's about you. It's about giving you the most important information that's necessary for you to handle your life. You are the captain of your ship. Health is a do-it-yourself program. I'll be right back. Don't go away. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio. It's beautiful outside. You get to go outside after you get done listening to me. It's really stunning. I'm going for a walk. I don't know about the rest of you. Maybe you want to join me. 888-630-9625. That's 888-630-9625. That's how you reach me here in studio. If you'd like to get some information from our office when we're not on the air, it's real simple. Go to rosellecare.com. That's ROSELLECARE.com. If you need to talk to somebody quickly, go to 703-698-7117, 703-698-7117. Ask my staff to have one of our very, very able staff to call you back, and they'll get it done and answer your questions and see if there's anything that we can do to make a difference in your life. Have a lot of things to talk about you today. We're talking about brain injury and the effect, what it means, how it happens, brainstem irritations. We've got a lot of little things that we want to deal with. Want to remind you, on the 18th of April, I'm going to have the pleasure of hosting the PBS twice Emmy-nominated award presentation at the Angelica Film Center in Merrifield, Virginia. It's $10 a head, and everything goes to Caring for Others, a 501c3 Virginia-based foundation. So not only do you get to see what happens with 6 people who had failed under medical care, not only make it better, but totally turn their lives around completely when they were doomed otherwise, but you get to write it off. And we're going to talk about it. We're going to move through the sequences of how we treated these people, why it's so important that you take control of your health and your life. So why don't you join me? Go to our website, go to rosellecare.com, and check it out. It's there. Just push the button, order your tickets, and love to see you. Shannon, how can I help you? Thank you for calling.
Hi. Question for you. You know, you were gracious enough to treat us a few years ago, and I just wondered if how the Brimhall techniques, you guys are so brilliant with your, with some of the therapies you do, and I didn't know how they affected primary reflexes, because years down the road we've run across different ways of treating those, and I didn't know how you guys worked with those.
There are many different approaches, and when you're talking about primitive reflexes or primary fundamental reflexes that a child has when they're born, you have to look at the fight, flight, survival system. When you see asymmetrical patterns in an infant, it's usually a clue that says something's not working the way it's supposed to. Developmentally, the primary system is transformed into the first year of life and then goes into secondary or partial writing reflexes. So primary means when a child's sitting there, they're kicking and moving, they have a cross-crawl coordination, and the primary reflexes may persist, far beyond for many children, and that's not okay. And that's when you have to begin to turn it around. But you're referring to John Brimhall, John being a very good friend of mine, but all John's done is put together multiple pieces of all the work that has been done and decide to clone it after his name. But John uses low-energy light laser. He uses cranial release patterns. He uses percussive therapies. He uses manual manipulation. He uses nutritional patterns, detoxification. He uses glasses, color scheme patterns to get the body back to center. But the point of it is that when you have an injury to the brain, whether it's in a child, whether it's an adult, what you want to do is you want to deal with the why, and then once you find out what the why is, then there's a lot of things that you can do with brain mapping. There's things that you can do with neuroassociative feedback patterns, and that takes it in another step outside of that. We refer out for those things, but we don't do it in the practice itself. There's a tremendous amount of capacity to reverse these things. In less severe damage, less severe disorder, there's exercises, there's writing reflex patterns that you can do with children, with adults, because that's when you see them when they're really bad. The process is to modify or inhibit the primitive reflexes and then enhance and re-educate and reform the secondary reflexes that need to be there. Anyway, Shannon, thank you very much. I appreciate your call. Bernice, how can we help you? Thanks for calling.
Hi. I have a question about NAC and scorpion bites. My friend's granddaughter a couple years ago got bit by a scorpion, and she reacted with, convulsions, and they had to give her, I think she said 3 of the serum shots, and she said that it cost like $50,000, and I thought, is there anything natural that could help a scorpion bite when you go into,
Bernice, you said something. You said NAC?
No. I wanted to know about NAC also.
Oh. Yeah. So that's a secondary situation.
Yeah.
Okay. So NAC, I'm going to go backwards on you, okay? Because that's got stuck in my brain. NAC is comes from the amino acid L-cysteine, and amino acids are, as you know, they're building blocks of proteins and they repair stuff in the body. And NAC is used for many different neurological stabilizing pathways in the body. It's used to counteract medications as well. So if you have a patient who's on Tylenol, for example, which is the number one reason why people are admitted to the emergency room for liver failure, and if you use NAC, it can help counteract the damage that Tylenol does. It also helps to deal with bile duct blockage. It also helps with patients who have ALS, Lou Gehrig's disease, Alzheimer's disease. It deals with the side effects of Dilatin, which is an anti-seizure medication, and it goes on. It's huge. But what NAC does, it's a strong neural stabilizing amino acid that is used across the board. We use it all the time for a lot of different things. Scorpion bites, hang on, kid. What we'll do is after the break, we'll come back. We'll talk a little bit about it because, it's very, very common, unfortunately, out in your area in Arizona, but there's some things that you can do. We're talking about many things, neurocognitive dysfunction. We're talking about scorpion bites, and we'll answer that question when we come back after some very important information and the people that bring you Dr. Tom Roselle Live. See you in a minute.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You listen to Dr. Tom Roselle Live. Indeed, I'm in studio. 888-630-9625. That's 888-630-9625. Listen, I want you to go to our website. I want you to go to rosellecare.com. We have so much coming up to educate you this year. You have no clue, and we keep adding more and more to the pile. If you want to know about things and you really want to have a hand in fixing them, if you really want to be the master of your own ship, your health ship, that is, you have multiple opportunities with us on an ongoing basis. We have our in-house continuing education programs that happen every other week on different topics presented by a phenomenal group of doctors that I have the pleasure of working with, and they're teaching me on a day-to-day basis. Go into Roselle Care. The list is there. Every other week we have an in-house program that we have as a fundamental basis of education for our patients. It's our healthcare class, and it's about the triad of health and the 5 factors and all the things that we do. And you're welcome anytime. Bring anybody that you'd like to bring with it. You can come 10 times. I mean, we'd love to have you. It doesn't make any difference. We're there for you. We'd love to be part of the educational process that will make your life better and stronger and happier and more fulfilling as time goes on. So all you got to do is go to our website, go to rosellecare.com, or give us a call, 703-698-7117. We're always there to answer your questions. We'll go back and forth with you on email. We've made a pledge to the community. The pledge is to educate you, to serve, educate, and empower you. And we do that as best we possibly can in every format that we can find to make that happen. In the fall, many of you already know about our Ageless Health Seminar. This is something that if you haven't been, you can't miss. Save the date. It's October. I think it's the 18th or 19th, whatever that Saturday is, and put it on your calendar. In a couple of weeks, you're going to start seeing the advertising for it. You'll have early bird registration. tons of stuff for you to do. It's amazing that the concept of your health is in your hands is true, except you're being kind of slid down the wrong side of the sliding board, and you have to take control. Let's go back to my friend Bernice. Are you still there, my girl?
Yes, I am.
Okay, girl, let's talk about scorpions. That's one of the reasons I don't want to live where you live.
Oh, I know.
I mean, those guys are ugly. You know, they're not fun. But anyways, scorpion bites can cause, as you know, some very nasty problems. And if somebody's very sensitive to it, it can either paralyze the nervous system, and you can check out with it. But the venom, if you will, the toxins that affect the human body, is very painful. And you know, you get somebody who's really young, like a child, or you get somebody that's old, that their immune system doesn't work, it's bad. But the general symptoms of that sting, of that bite, can go from anything from something very mild, a tingling or a pain or burning, a lot of inflammation, swelling, to very significant things like nausea, and you can have, you know, blurred vision, you can have headaches, you can actually get sick for a long period of time. And if you have a primary respiratory or cardiovascular problem, you could be in real serious trouble. So what can you do? So one of the things that you want to do immediately is, you know, like get the area super clean. You know, wash it with really, really strong soap and water, and then cold compresses, not hot. You don't want that water real hot. This is one of those things that if you put hot, you're going to drive the venom into the system. So you want to do cold over the area, and you want to remove rings and things like that because they're going to impede the circulation, but they also cause other types of problems that you don't have to want to deal with. So you want to reduce the pain. You want to get rid of the inflammation. Even things like curcumin are really good to handle it. But I'll tell you, an old thing that you can use for yellow jackets and wasps and so forth is just old-fashioned baking soda. Get a compress of baking soda, put it over the top, and if you see it begin to modify within a short period of time, what do I mean by a short period of time? I'm talking about, half hour, and it looks like it's getting less. But if it starts moving, you start seeing some red streaking, get yourself to an emergency room, like, quickly. But curcumin is one of the better things that can be used. There's a product from a laboratory that we use a lot of, standard process laboratories, called Antranex. It's the active ingredient is something called Yakutron. Tincture of arnica, arnica, the homeopathic, that'll work really well. But you got to get to it very quickly, and low dosage, 6x is what you're looking for. That will help dramatically decrease the swelling. There's a combination of things that, old clay is used for lots of things, but if you mix it with vinegar and you put it on there and wrap it tight, and change it out every few hours, that will pull the venom out. But the faster you get to it, the more quickly, from a natural standpoint of view, that you can handle this. But if you know that you've got allergic reactions to any kind of bee sting or venom sting, emergency room is your friend. You got to get there pretty quickly. Can
you give somebody I know you can give a dog peroxide for them to throw up, but
no,
you can't give humans.
Well, there's food grade hydrogen peroxide, but no, you don't want to do that yourself.
Like 3%.
I'm sorry?
The 3%.
Yeah, but don't use it.
Oh, okay, don't use it.
Okay, don't use it. No, your risk level's too high. Peroxide you can use for topical stuff.
Yeah.
You can use it to get infection out of your teeth and your gums and so forth, and that's a whole different story. But no, don't drink it.
Okay, yeah, her granddaughter had a really bad reaction to it. I mean, she had 17 people in the emergency room holding her down because she had reaction, convulsions.
Exactly.
Yeah, I just thought maybe there was something she could do real quick for her if she got bit again.
No, you have to be aware. If you know that you're going to have a reaction, even an EpiPen, an epidural pen, an epinephrine pen, not an epidural pen. An epinephrine pen is good to have with you if you know that you have that type of sensitivity. Because if you go to anaphylaxis and your respiratory system begins to close off, you got a problem. And, you don't want to deal with it. Bernice, listen, hon, good to talk to you. Appreciate it. We'll see you soon. Ava, how can I help you?
My name is Eva, doctor, and I listen to you on the radio. And are you there?
Yeah, I'm here. I can hear you.
Okay, good. I'm 76 years old. I'm diabetic. I take really good care of my diabetes. But to make a long story short, I had epidural done for fire, like a fire burning feeling on the back, and and front of my thighs. I had 3 steroid injections, and that went away. And after that, I remained with like nerve pain, like sciatica.
Yeah, of course you did.
Different kind of pains in my legs. And I just heard you say while I was driving home from church about, your balance is off and this and that. Now, and I also heard you say about Tylenol. I can't take painkillers.
Okay, let's deal with let's deal with the epidural, because that's really significant. And I want to tell you a little bit about it. Epidural shots are things that they, even in the medical community, if they're smart, they only use 3 times. And they use the first one. If there's some benefit, they might do the second one, but it's always the last case resort. You don't do them just because. They are a steroid, and they cause the body to break down. Now, when you puncture the dura, which is the covering of the spinal cord, you can cause it to tighten. You can cause other symptoms to occur. The fact that you're diabetic makes it even worse, because what you're doing is you're suppressing the fight-flight system, which is the adrenal glands, these small little glands that sit on top of your kidneys. They're responsible for sending a signal to your pancreas to release insulin. So if the adrenal system's not working the way it's supposed to, your diabetic situation becomes progressively more serious. Now, if you're 76 years old and you have a diabetic condition, there's a lot of things you should be doing, and I'm not pointing fingers, I'm just broad brushing this thing. First of all, you need to be eating multiple times a day, 5 to 6 times a day, lots of protein, tons of vegetables, seeds and nuts, and every carbohydrate in your life and every sugar should go out of it.
Well, that's how I eat, doctor.
Okay, good.
Because the last reading on my blood work was a 6.1.
That's your A1C hemoglobin. That's right.
Yes.
What's your blood sugar? What's your blood sugars in the morning?
In the morning, under 120. Sometimes, it could be 110.
Okay. What kind of exercise do you get?
Well, I walked every day for the last 35 years.
How much?
I keep track. A half hour, 5 times a week. But I start to do like 10 minutes at a time because I have a severe discomfort, and I'm on Lyrica, which is helping me a little bit.
The Lyrica is going to destroy your nervous system over a period of time, so you have less sensation. That all of that neurological diabetic neuropathy, that kind of stuff that they want to give it to you for. It blocks neurological input to your system, but it just doesn't act in your feet. It acts every place else in your body as well.
That's
right. So you have
and it makes you very tired.
That's right.
I'm a very active 76-year-old.
So Ava, let me tell you this. You're not as healthy as you could be. There's other things that you could get done to support your diabetic situation, but the medications that you're on will progressively make things far worse than what they are. Ava, I'd love to talk to you further. Send me a note, and I will get back to you, and I'll help you as much as I can through the forest a little bit here. Sylvia, how can I help you? Thank you for calling.
Hi, good afternoon. I was questioning B12. My husband brought home some of the B12, and it said 2,500 micrograms NCG a day. And when I looked at the back of it, I was looking at the package, it said that is about 42,000% of the daily value. Is that healthy or is that bizarre?
No, it's not bizarre at all, because I use it in far greater dosages than that with our patients. So here's what the thing is, what you got to understand about B12. There are many different forms of B12. There's something called cyanocobalamin, which is the one you normally see, and that's because the reason that you see the most of it is that because that's the cheapest to produce. Second is methylcobalamin, and then there's another one called hydroxycobalamin. So it depends on what you're trying to do. Hydroxy is a scavenger. When you're trying to deal with methylation or inflammatory pathways that are in the body, methyl sometimes works the best. But you always want to give B12 and folic acid together, and then you have another subset. You have to be careful if somebody has a problem with MTHFR conversion, meaning that they can't take folic acid and convert it into folate, then they've got a problem. And that's a phase 1 problem with the liver. Your liver has multiple phases of detoxification. Phase 1 handles some of the things that we're talking about right now. So it's not bad. You just want to make sure that it's 5 parts folic acid, 2 parts B12. And when I give somebody B12 to bring down inflammatory patterns in the body, or because they have a heart problem, or because their A1C hemoglobin is elevated, or their homocysteine is elevated. I'm going to give them a lot of things, but what I want to see the next time I run a blood test is I want to see the B12 actually outside its normal level. Why? Because once it's outside the normal laboratory patterns, it tells me if I'm getting good saturation and I'm seeing the other markers come down, I'm seeing homocysteine come down, I'm seeing A1C come down, if I'm getting that saturation, now I want it in the bloodstream. And I want it in the vessels so it can begin to repair damage in the cardiovascular system. So there's B12 you can't get hurt with, and it's great for cognitive restoration. I have patients who have all kinds of neurological problems, and one of the things I always give them is very, very high dosages of B12. I would not use a cyanocopolamide. I would use a hydroxyform.
You mentioned that the cyan, whatever it is the cheapest form. What would be the best forms daily to take?
Hon, it depends on what the problem is, but I would at least do a methyl or a hydroxy form. Those are the ones that we use therapeutically. I almost never, ever use the cyanocopolamide because it's not as effective, doesn't work as well. But the thing that you have to remember is you have to make sure that it has the 5-to-2 ratio with folic acid, and it'll make a huge difference.
Thank you very, very much. I appreciate it.
Sylvia, you're welcome. Thanks for calling, and I appreciate it. Keith, how can I help you, sir? Thank you for calling.
Good afternoon. I was recently told that I have something called Dupuytren's syndrome.
Contracture.
Yeah, I got a lump grew on my palm, and of course, modern medicine just says, well, stretch your fingers, and if it gets worse, we'll do surgery. I'm wondering if there's any kind of a homeopathic or a method, or is there a diet change that I could use?
Interesting you should ask. There's a lot of reasons that the Dupuytrens show up. Some of them are from injury. I've seen patients with burns, significant burns to that side of their body all of a sudden form a Dupuytren's. It has to do with fight-flight phenomena. It has to do with the adrenal system. It has to do, by the way, with B12 folic acid patterns. And you can, besides the stretching, one of the things that you want to do is dramatically increase the B12 level, 5-to-2 ratio with folic acid. But you also want to use other things that have to do with fascia, stretch, and adrenal support. Each person's different, but it's the predisposition that allowed you to get there, that you did something either using your hands or an injury or your hands are tightened and so forth. So how you want to deal with that? When we deal with it in the office, we use acupuncture, low-energy light laser, nutritional protocols, and active release, active stretching of the fascia. And often we get some very, very significant results. If it's gone to the place where it's starting to make your hand claw and tighten down, sometimes it's already affected the tendon and it's too late, and then you have to have surgical release. But if you catch it in the early stages where the lump is just forming, then it's time to act and act quickly. But it tells you straight up that those areas are impaired and they needed to be supported anyway.
Well, I have this. You mentioned B12, and I do have pernicious anemia, which is the low B12.
So that tells you your predisposition, right?
So I should talk to them about that.
Yeah, and what I would also find out is if you have a MTHFR conversion problem, because if you just take folic acid and it can't be converted into folate, it's not going to do you any good. And usually the pernicious anemia problem comes from an MTHFR problem. So, Keith, if we can help you in any way, because we treat them all the time, give us a call. Appreciate your phone call. It's one of those things that if you act quickly, you can stop it from advancing, number one. But number two, since you've got a pernicious problem, it tells you that there's other things that are cooking, that are going on, that you really need to pay attention to. And don't ignore it. Now's the time to really do what you need to get done. We're coming up to that place where we have to acknowledge some very important people. I want you to stay tuned. Don't go away.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio today on this beautiful, beautiful, almost spring day. It is spring on the calendar, but it's a little nippy outside. I want the flowers. I want all those beautiful things that put color into our lives, you know? We're at 888-630-9625 every Sunday. And when you try to find us when we're not in the studio, all you have to do is go to rosellecare.com. That's ROSELLECARE.com. And check it out, because there's a whole lot of stuff there for you. Actually go through it, you know, kind of tiptoe through the different pages of our website, and I think you're going to be very excited about the things that you find. And it actually ties into another website called drtomroselle.com. So I'm going to give you a little hint. Here's the hint. On Sunday, May the 3rd, it's going to be a very special thing that's going to be happening. Sunday, May the 3rd. It has to do with radio. And I can't tell you all the details, but I will tell you a website as we go through the next couple of weeks where to find it. Dr. Tom Roselle is going to be carried on 18 other stations, not at the same time and not in the Washington metropolitan area. It's going to be other than here. But we'll do this program at 12 o'clock. And then at 4 o'clock in the afternoon, from 4 to 5, we're going to do another program, and you can get that one on your internet. You'll be able to log in, and then we'll continue the same topic all the way through, and you'll be able to call in on that program as well. But we're going to be outside the Washington metropolitan area, 18 stations throughout, probably from Texas all the way out to this area, soon to be 35. We're looking to have fun with it, and it gives me the opportunity to really extend the information to you and make a difference. So you can go online, you can talk to me, you can listen to the program, and for some of you that are on the tail end fringes of where WMAL reaches, you'll be able to tune in to other small local stations. And they're small local stations, but we're going to have fun with it, and it's there to serve you, to make a difference so we can continue educating you at extremely high level. I'm looking forward to doing that, and we'll give you more information, but you'll have to go to our website as we reveal it to find out where, when, and how, and we'll let you know as time goes on. Okay? So having said that, I want to tell you a little bit, for a couple minutes we have left, about neurofeedback and brain mapping. Years ago, when I had those brain injuries that I've told you about many times and try to compare certain things, my ability to word find was impaired significantly. And most of you know me that the faster I talk, the better I feel, and the more information I can get out, and the more finesse to my cadence. If I slow way down, my brain just kind of starts backfiring, and guess what happened with that type of injury is that I had to slow down. And so subsequently, if you hadn't heard me before and you just heard me say, like that, you'd say, well, that's just his, but that wasn't me. So, but brain mapping identifies areas of dysfunction due to trauma and other types of things within the body. And it can be damage from heavy metal toxicity. It can be damage from metabolic problems like hypoglycemia. It can be sleep aberration. It could be vitamin deficiencies. It could be Lyme's or other microorganisms, candida. All of those things can cause that, if you will, that mess up in the brain, so your body doesn't communicate with the brain the way it was meant to do. So there's many different ways of doing neurofeedback patterns with exercise, with certain brain stimulatory patterns, but there's also ways of doing it with, if you will, computerized programs that, after attaching certain electrodes to your brain and so forth, you can stimulate certain centers of your brain to reconnect their normal information relay stations and points. And this stuff is good. We're going to talk in probably over the summer. I'm going to have a couple of people who specialize in neurofeedback and neurocognitive dysfunction, and we're going to talk about what this is all about. So put that in the back of your mind, and we'll make sure that happens for you. You know, we're here every Sunday bringing you the most intimate and updated information on integrative and natural therapeutics. This is why we do what we do. This is why I dedicate my years to you, to make sure that you have control. I'll see you next week, same time, same old place. This is Dr. Tom Roselle.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Hip and Knee Pain with Dr. Harlan Browning on Wednesday, April 1st at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.